Although they did not weigh in this year. That's what they told us previously. That's what Kevin Lembo.
Good morning, everyone. I'd like to call the Human Services Committee meeting for Tuesday, March 28th to order. And then we are going to recess. Stand by. Good morning, everyone. Going to call the Human Services Committee back to order. I hope everyone is doing well. We'll kick it off with some remarks. Senator Lesser.
Good morning, Madam Chair. Just excited. This is our last anticipated meeting of the Human Services Committee. You never know, but it's been great to work with members of the committee on both sides of the aisle. And I thank you for your leadership in particular, Madam Chair.
Thank you. Representative Case.
Thank you, Madam Chair, and looking forward to the meeting. And I just wanted to reach out and say thank you for the collaboration and working to pull this S language together and putting up with the 8:30 communications. But we got things together, and hopefully we can have a good meeting.
Wonderful. Thank you. And Senator Seminara.
Good morning, everybody. I'm sorry I could not be there in person, but I look forward to having a great meeting. Thanks so much.
Thank you. With that, we'll move to item 3 on the agenda, bills for review. Number 1, Senate Bill 989, an act concerning nursing homes. Do I have a motion?
Motion to JFS to the floor.
Is there?
Second, Representative Dathan.
Wonderful. Motion by Senator Lesser, seconded by Representative Dathan. As was said, this is a JFS to the floor. This is our committee's nursing home bill. It does a variety of things to address the various needs that we've heard with regards to nursing homes. The S language before you makes a few changes that I want to talk through. It requires the Department of Public Health to determine what nursing homes lack air conditioning in patient rooms, costs, and the feasibility of supplying it, and report back by January 2025. It then requires those nursing homes to provide AC in every room, every resident room by January 2026, and it retains the revolving loan fund to provide financial assistance to nursing homes to put in the air conditioning. It requires the Department of Social Services to study whether a lack of reliable transportation for nursing home bound seniors is a health-related social need that potentially could be covered under Medicaid, and report back to MAPOC. It deletes sections requiring changes in nursing home requirements that wait lists be electronic in favor of a working group. We think this is an important provision to be able to move to the electronic waiting list, but we want to make sure that there is still accountability. It pushes requirements that nursing homes provide plain language summaries of items in their cost reports to January 2024, and then removes provisions requiring nursing home staffing ratio increases. That's been a big conversation at this table and in this building. The Aging Committee's bill still includes an increase to nursing home ratios. Our thinking is that at the same time that we're having conversations about the staffing shortage, it's important that the conversation continue on, but that for this year, we didn't include it in our bill. With that, I'll open it up to questions and comments. Oh, I'm sorry. Online. Representative Mastro Francesco, go right ahead.
Thank you. Thank you, Madam Chair. I just have a few questions for clarification, if I may. On lines, in the substitute language on lines 8, beginning on lines 18, it talks about the Department of Public Health is going to submit a report to the Committee of Cognizance based on their recommendations. And when in reference to requiring air conditionings in rooms in the nursing home. Is that a study group that they are doing, or is it just the Department of the DSS, Department of just getting the information and supplying it to the committee?
So this is a study required of Department of Public Health, but they will be, in order to fulfill it, they would need to connect with and reach out to the nursing homes in the state.
Okay, thank you. So they are still, the nursing homes will still be required based on the language here by January 1st of 2026 to provide air conditioning in every resident room. And the committee, the Human Services Committee, when I look at the requirements for submitting a report, it's just submitting of a report with their recommendations. So when they submit their recommendations, regardless of what the recommendations are based on the language in this bill on line 29, January 1st, 2026, nursing homes will all be required to have air conditioning as every room. Am I reading that correctly, Madam Chair?
You are.
Okay, so there is no, the Human Services Committee is not going to reconvene look at their recommendations and maybe change that particular date because we are putting it in statute today. We are just saying that they're going to give their recommendations, and by January 1st, 2026, every nursing home is required to put air conditioning in every room. Okay. That I am very concerned about that. On section 2 on lines 42 of the substitute language, can you explain to me a little bit about the revolving loan account to provide financial assistance to the owners of the nursing home facility and how that works?
Yes, and this was included in the original bill, so this isn't substitute language. So this loan account, we have heard from the nursing homes that many of them wouldn't have the upfront costs to be able to put in the air conditioning. Many of the nursing homes are in older buildings, and so this would be a loan account where they could tap into to be able to cover those costs. How that's going to be funded would be decided as this moves forward to the Appropriations Committee.
Thank you for that clarification. So, for example, there are going to be requirements to receive that loan. There's going to be eligibility requirements. Should a nursing home not be eligible and get approved for that loan, and they cannot afford to put the air conditioning into each of these rooms, what would happen?
There's no penalty, but ideally that's why the requirement is January 2026. They have time to figure that out before they have to have the air conditioning in each residential room.
I understand that. My question is though, they don't have the money, they cannot afford to put air conditioning. They don't have the finance to put air conditioning every room. And by that date of 2026, they do not have it. What will happen to the nursing home?
At this point, based on this bill, nothing. We could come back in future years and amend that. But at this point, it's just a requirement that they have them by 2026.
Right. So it's in statute that they're required to have it, but should they not have it, I guess nothing was going to happen. So they're not really required by January 2026 to have the air conditioning if they can't afford it and they just can't do it. It doesn't really make any sense to me. Okay, and just one other question for clarification, if I may. In sections on line 74 through 79 of the substitute language, on line 76, it talks about that money can be withdrawn by the authority for such account and used for other purposes of the authority. What do they mean by other purposes?
In looking at this language, my understanding would be that if the monies are needed to do something in order to prepare for the air conditioning, that would be allowable. But it does say subject to specific restrictions governing any contribution to such account.
Okay, thank you. I'm just trying to figure out that the authority, which would be the state, they can withdraw money from that account and use for other purposes of the authority. And I'm looking for specifically, what does that mean? What are other purposes? Would you have the answer to that by any chance?
I did just give an example. So if some modification needed to be made in order to be able to put in the air conditioning, if it's associated with the air conditioning.
Okay, I understand that, but that is not defined in this bill. That's what your interpretation of it is, but it's not defined in this bill. And what I'm concerned about, that money can be used elsewhere because we're not defining it in here. Okay, thank you for answering my questions. I'm going to flag this with a no today. I have some concerns on the language on this bill, and perhaps it may change before it hits the floor, but I'm going to flag this with a no today. Madam Chair, thank you for answering my questions. I appreciate it.
Thank you, Representative. And Representative Case.
Thank you, Madam Chair. And just to follow up on that, I see the study is for 2025. As we know, within our history of studies, we don't always get them on time. What would that do to this bill?
there would still be the requirement that the air conditionings be put in every residential room by 2026.
Okay, and I heard you talk about that there'd be no penalties, but if you go 2025 to 2026, in a lot of commercial settings right now, it's taking up to 12 to 16 months to get equipment and stuff in hand in order to do this. So if somebody goes 2017 or 2027, there's nothing in here from stopping them from doing it to 2027, correct?
Correct. And I think this is a very valid point. We could go back in and put in some type of penalty.
Okay, well, I think this is different language and it's better language than what we had before by mandating it. At least we're gonna find out what and how many facilities don't have this in every room. And then we're also gonna find out what if DPH comes back and saying that this is a facility that really is restricted from having it because of the type of building. Where do we go from there through you?
I think that's the very information we want to know. And then that information will help us to figure out where do we go from there and how can we help a facility that structurally can't have air conditioning in each room.
So the study would come back to us, but if there's a facility that structurally can't do this, but they are meeting all of the cooling requirements and heat requirements, there's still the language that it needs to be installed by 2026. If it's not able to do that, do we have latitude to work with? What I'm saying is the report comes back to us. Do we go and work with them to make sure that this can be adequately done to suffice?
That would be my hope.
Well, my hope too. So, just because there are a lot of older buildings throughout the state, there are a lot of newer buildings throughout the state. So let's take that and there's a lot of changes that happen within 989, a lot of good things. I'll leave it at that if anybody else has any other questions. Thank you, Madam Chair.
Thank you, Representative. Any additional questions or comments? All right. Seeing none, would the clerk please call the roll?
Item number 1 on the agenda, SB number 989, an act concerning nursing homes. The motion is a JFS to the floor, LCO number 686-6468. Representative Gilchrist,
Yes.
Senator Lesser, Senator Seminara,
Senator Seminara votes yes.
Representative Case.
Yes.
Senator Gaston,
yes,
Representative Dathan, Senator Marr, Representative Butler, Representative Cook, Representative Exum,
Representative Exum votes yes.
Representative Fortier,
Representative Fortier votes yes.
Representative Hughes,
Representative Hughes votes yes.
Representative Johnson, Representative Kitt,
Representative Kitt votes yes.
Representative Leeper,
Representative Leeper votes yes.
Representative Santiago,
Santiago votes yes.
Representative Buckby,
Yes.
Representative Ferraro,
Yes.
Representative Mastro Francesco,
Representative Mastro Francesco votes no.
Representative Pizzuto,
yes,
Representative Paletta,
yes,
Representative Butler, Representative Johnson. Thank you, Madam Chair.
Thank you, Madam Clerk. We will hold the votes open and make an announcement towards the end of the meeting about what time. All right, moving on to item 2 on our agenda, Senate Bill 1109, an act concerning Medicaid reimbursement to community living arrangements, intermediate care facilities for individuals with intellectual disabilities, residential care homes and nursing facilities. This is a JFS to approach. Do I have a motion?
So moved.
So moved, seconded.
Moved by Senator Lesser and enthusiastically seconded by Representative Hughes. So this came to us from the Department of Social Services. We have made some changes to the bill. It removes language prohibiting inflationary rate increase in nursing homes and other facilities. It adds language in conformance with the governor's Human Services bill, allowing for increased fair rent reimbursement when funding is appropriated. It allows interim rates in certain circumstances when nursing homes can demonstrate financial impact and costs of circumstances not addressed in rates. And it prohibits nursing home rate withholds in the next 2 fiscal years to implement the value-based reimbursement system. Any questions or comments? Senator, no? All right, seeing none, would the clerk please call the roll?
Item number 2 on the agenda, SB number 1109, an act concerning Medicaid reimbursement to community living arrangements, intermediate care facilities for individuals with intellectual disabilities, residential care homes, and nursing home facilities. Motion to JFS to approves LCO number 6469. Representative Gilchrist.
Yes.
Senator Lesser.
Yes.
Senator Seminara.
Senator Seminar votes yes.
Thank you. Representative Case.
Yes.
Senator Gaston.
Yes.
Representative Dathan. Senator Marr. Representative Butler. Representative Cook. Representative Exum.
Representative Exum votes yes.
Representative Fortier.
Representative Fortier votes yes.
Representative Hughes.
Representative Hughes votes yes.
Representative Johnson. Representative Kit.
Representative Kit votes yes.
Representative Leeper.
Representative Leeper votes yes.
Representative Santiago.
Santiago votes yes.
Representative Buckby.
Yes.
Representative Ferraro.
Yes.
Representative Mastro Francesco.
Master Francesco votes yes.
Representative Pizzuto.
Yes.
Representative Paletta.
Yes.
Thank you, Madam Chair.
Thank you, Madam Clerk. And as was mentioned, we will hold the votes open. Moving on to number 3 on the agenda, Senate Bill number 1111, an act concerning excess nursing home beds and payment for non-patient care in nursing homes. This is a JFS to the floor. Do I have a motion?
So moved.
Is there a second? Moved by Senator Lesser and seconded by Representative Dathan. This is an agency bill that came to us that would have, it was looking at when nursing homes got below 90%. I am forgetting the word. If they didn't have full bed capacity, if they had bed capacity lower than 90%, after a year, it would reduce, they would get a financial penalty. What we ended up doing, so what you have before you with the S language is it strikes the underlying bill calling for that financial penalty for the nursing homes with excess bed capacity, and in favor of a working group with industry reps to work out these issues. Once again, there was a ongoing conversation about the limited labor pool on filling and staffing the licensed beds. And so DSS had conversations with the industry and they decided to move forward with a working group at this time. Any conversation or questions?
Chair, can you give me 1 second?
Yes. We'll stand at ease. All right, any questions or comments? Seeing none, would the clerk please call the roll?
Item number 3 on the agenda, SB number 1111, an act concerning excess nursing home beds and payment for non-patient care in nursing homes. Motion to JFS to the floor. LCO number 6356. Representative Gilchrist.
Yes.
Senator Lesser.
Yes.
Senator Seminara.
Senator Seminara votes yes.
Representative Case,
Yes.
Senator Gaston,
Yes.
Representative Dathan, Senator Marr, Representative Butler, Representative Cook, Representative Exum,
Representative Exum votes yes.
Representative Fortier,
Representative Fortier votes yes.
Representative Hughes,
I'm sorry, could I have you hold on for 1 second?
Representative Johnson, Representative Kit,
Representative Kit votes yes.
Representative Leeper,
Representative Leeper votes yes.
Representative Santiago,
Santiago votes yes.
Representative Buckby,
Yes.
Representative Ferraro,
Yes.
Representative Mastro Francesco,
Yes.
Representative Pizzuto,
Yes.
Representative Paletta,
Yes.
Representative Hughes.
Yes. Representative Hughes votes yes.
Thank
Thank
you.
you.
Thank you, Madam Chair.
Thank you, Madam Clerk. All right, next we will move to item 4 on the agenda, Senate Bill 1174, an act concerning minimum employee wages, healthcare coverage, and retirement benefits for nonprofit providers of state-administered services for persons with intellectual or developmental disabilities. This is a JF to approach. Do I have a motion?
So moved.
Is there a second?
Second,
Moved by Senator Lesser and seconded by Representative Fortier. This bill requires nonprofit employers by 2023 to implement a schedule of wage increases to employees who provide services to people with IDD to ensure that all employees attain a minimum wage of $25 per hour by 2026. It appropriates monies to increase wages for nonprofit employees providing services to people with IDD authorized by DSS and DDS to receive services. It requires the comptroller to offer nonprofit employers and their employees healthcare coverage under a partnership plan. It appropriates dollars to establish a funding pool for OPM to allocate to nonprofit employers to enhance employee retirement benefits. With that, I'll open it up to questions and comments. I see Representative Leeper has her hand raised. Go right ahead.
Thanks, Madam Chair. I actually had the really good fortune of touring Ben Haven School yesterday, which just does a phenomenal job of serving this population in our state. And am well aware that there are not enough settings like that, and certainly not enough spots in their schools, nor placements in their residential facilities for the demand that we see across the state. And we also currently are experiencing a huge gap in funding for our public sector placements versus our nonprofit placements. So for that reason, I'm very supportive of transferring funds to DDS and DSS for this purpose. I have some concerns about Section 1 and lines 35 through 39 of Section 2 that are sort of tying the hands of our providers in ensuring that this is to accomplish a specific minimum wage. But I very much want this to continue through the process. So we'll vote yes today and look forward to continuing conversations around that. Thank you so much, Madam Chair.
Thank you, Representative Leeper. Any further comments or questions? Representative Case.
So some concerns have come in. Question to you, when we do this, are we including any other employees other than DDS employees through you?
Not in this. Well, it does address DDS and DSS. So it's for nonprofit employees providing services to people with IDD authorized by DSS and DDS.
So in some of these facilities, we have DEMIS employees and they're under DPH. Where would they fit in? Because they work within the same facility.
This bill does not address those employees.
So you'd have employees working side by side with each other, making a different wage through you?
So moving forward, what we'd like to see already out of this committee, we've passed 2 additional pieces of legislation, one to address Medicaid rates and the other to address the nonprofit health and human services providers. And so it's our intention that going forward, once we get this bill out of committee, there will be a bigger conversation about the need to increase wages for the entirety of the nonprofit provider community who are providing services. But at this point, this bill only speaks to those specific employees.
So you're talking about appropriating 106 in 1 year and 196 million in another year, but we're only doing it for one population, from what I'm hearing for you, of workers. And looking down the line to work with others, my concern is, what are we doing to the nursing home CNAs, the other workers within these catchment agencies? This is just one population that we're picking winners and losers. We're doing this for one group of people. Why are we doing this just for one when we're talking about all the low wages in the nursing homes and trying to get nursing home help through you?
I hear you, and I see this as part of that larger conversation about the need to increase wages across the workforce. And so do anticipate that this will be married with other proposals to ensure that we can address the financial needs and workforce shortage across the board.
Thank you, Madam Chair. And can you explain the effective date upon passage, the sections appropriating funding to OPM for not only wages, but the partnership plan?
What section and line are you in?
Just give me 1 second, and this is no reflecting me. We got S language and we got all these languages last night around 8:30, so I'm working through this. Section 3 of the bill, Madam Chair.
Section 3 addresses the comptroller offering nonprofit employers and their employees healthcare under a partnership plan.
Through you, do we do this? And doing a little research, would this violate ERISA through you?
It is our understanding it would not violate ERISA.
Can we ask LCO if that's that proper through you?
So section 3 references statutes in section 3-123 AAA through CCC. And under those statutes generally reference a program known as Partnership Plan 1.0. And in those statutes, there's a process for the comptroller to make a determination as to whether allowing nonprofits to participate in the partnership plan would result in a loss of ERISA status for that plan. And if he makes that determination that it will, he does not go forward with allowing the nonprofit employees into the plan.
Madam Chair.
Representative Case, I'm going to turn, Senator Lesser also has a response. Senator Lesser.
Madam Chair, just a point of clarification, would loss of ERISA, my understanding is currently the partnership plan has an ERISA exemption. So which is it correct that you're referring to a loss of the exemption that Connecticut's plans currently receive? So Connecticut would therefore have to comply with the terms of ERISA, not rather than violating ERISA, just would have to comply with ERISA. Is that what you were trying to say?
Yes, that's correct. Thank you. The comptroller makes a determination as to whether allowing nonprofit employees to participate in the plan would result in loss of the ERISA exemption for the partnership plan.
I thought that was important clarification, because right now it's not complying, but under this, it might have to comply with the terms of ERISA.
Thank you, Senator Lesser. Representative Case.
So through you, is this a path down to opening up the public option through you?
No, this is just allowing nonprofit employers and employees to be able to get coverage under the partnership plan.
And do we anticipate by opening this up, is that anticipated significant cost to appropriations through you?
Guess that would depend on your definition of significant, but we don't have that cost yet. We don't anticipate it being significant.
All right, I think my biggest concern is we are in this bill and it's laudable because I do, our people take care of our most vulnerable people. We need to work with them, but we're picking one population here. We're talking in this committee so much about nursing homes, CNAs, PCAs. But now we find one to do $25 an hour by 2026 at $106 million the first year, $196 million next year. And we have so many other agencies that do some of the same work that we're doing nothing for. For that, I'd have to be a note today. Thank you.
Thank you, Representative Case. Any additional questions or comments? Seeing none. Oh, yep, Representative Pizzuto.
Thank you, Madam Chair. I was trying to find the line item. I can tell you the gist of it. On where it talks about appropriating $90 million to OPM for FY25 to establish a funding pool for OPM to allocate to nonprofit employers to enhance employee retirement benefits. Do we have any say over, I mean, is it in the extreme? I'm saying you can use it to go on vacation. You can do whatever you want. Are there any constraints?
I believe this is thought of as the traditional benefits that folks get in a workplace.
I mean, I know that, in my district, I have, I know right now we're talking about Demas, but I have a hospital that's unionized, I have one that's not. And so there are no ERISA rules. It's a nonprofit. And eventually this may set a precedence to do that. And I think it was to my good ranking member's point that we're opening up a door to try to help with retirement benefits, but we're picking and choosing winners. Thank you.
Thank you, Representative. Representative Cook, followed by Representative Case.
Thank you, Madam Chairman. I'm really torn with this. So is the person calling. I'm really torn with this piece of legislation. I understand the intent. I do understand the intent. I do not appreciate that because we have multiple departments working under the same roof, we're talking about multiple pay scales. I also am very concerned about the fact that the partnership plan of which is being referenced here. I've had a conversation with the chair of the insurance committee. That partnership plan is insolvent. And if we move to put that direction in there, we're giving some false hope that that is a possibility. So my question first would be, has either one of the chairs had a conversation with the insurance chairwoman about the insolvency of the partnership plan?
Not as of yet. The plan is once all of our JFs were done to be meeting up with the various chairs of the committees.
So I do have a concern with that. And it is with all respect to the chairs. I understand that there's a lot of work there, but if we're putting something in legislation and we're directing something to a program that is insolvent, then I don't believe that we should direct it to that program. And I think it's extremely important that we have a conversation with the insurance chairs about where we're sending something, or we're sending something out of here to die. So that is my concern. And the only reason why I have more of an intimate knowledge on this is because we were actually looking to put a couple of other groups into the partnership plan, paraprofessionals, and so forth. And that is where we had learned that partnership plan is insolvent. So for me, I mean, I understand the conversations. I understand the need for movement on this. I do hope that if this moves and this survives, that there is a lot of work done with this. I also am extremely concerned with the fact that there has been no conversation with the insurance chairs if we're trying to put something in an insurance program. Or with the comptroller, and the comptroller was actually the one that had suggested originally for me for something. And then when I went to follow the insurance chair, that's where I learned the insolvency. So I support these workers. I support what they do. I think that we might be moving to false hopes. I'm willing to move it, but I'm extremely concerned about where we are going with this, given the fact that all of our ducks are not necessarily in a row. So, thank you.
Thank you, Representative. And we do truly see this as a work in progress. Representative Case?
Thank you, Madam Chair. So when we're looking at this at nonprofits, is there a caveat in here? The nonprofit is a union or non-union shop through you?
I don't believe so.
So it's across the board, just for the IDD community, just for clarification, correct?
Yes.
Okay. Like I said before, I know others had said they'd like to move it forward, but I honestly think for the hundreds of millions of dollars a year and for all the groups that were left out of this, I cannot support this today. If it comes to the House floor, maybe we can have a discussion, but I think, you know, for all the points I mentioned, I mean, this is one that is near and dear to my heart, obviously, because, you know, my brother lived in a group home and I get what the employees there do, but we could be looking in the billions of dollars once we do this for all the groups, but I'm not one for picking winners and losers and deciding who should get a higher rate than the other, especially in certain facilities when some of these people are going to be working side by side. And when you do this rate increase, there's a compound effect for the people above that are going to have that increase also, and we're not supplying the funds for that. And this is a bill that can not only help, but it can also hurt. And I want to make sure that we're clear on that because our nonprofits are struggling right now. We did hear some great testimony on employees and their great work that they do. But quite honestly, I don't like using this term, but I think we're giving false hope. And I hope I'm wrong, but I can't support it today, given false hope. Thank you.
Thank you, Representative. Representative Buckby.
Thank you, Madam Chair. I'm taking in a lot of this conversation and there's a couple things that I want to get to on it. It's not about deserving for the people. I think as someone who comes from a nonprofit community, that's the other piece that's really difficult to try to digest is where to find the funds in a lot of this too. And we're looking at a massive lift here on our end, right? This is a huge dollar amount that's on here. And I agree with my colleagues. I think it's dangerous precedent we're getting into, and I think it's a concern financially. I also am concerned with the bills that we're pushing through that are, you know, work in progress still. This is what the committee process is for at this point, to get us to a point where we're ready. There's so many that are not completed and not quite there, and we're still working on, and that it's concerning with something with this large of an impact, with a massive impact, that we're looking to push it through so quickly. I think it needs more work. I'm assuming it's going to pass, and I like my good ranking just said, I hope for the best, but at this point, the way it sits, I just can't find myself in a position to support the bill at this point. Thank you, Madam Chair.
Thank you, Representative. Representative Dathan.
Thank you so much, Madam Chair. And I know this is a big issue, and I heard it from the nonprofit providers in my district that trying to find a talented, dedicated workforce is really their biggest challenge. We need to figure out how we can make it work. And I am a little concerned about the cost, and I hear my my other committee members express their concerns and hear them. But I do believe we need to carry on this conversation, and we do need to figure out how we can address these workforce development issues as a whole. And I am going to support this bill to get it out of committee so we can carry on those vital discussions. So thank you very much, Madam Chair.
Thank you, Representative. Representative Mastro Francesco.
Thank you, Madam Chair. I'm just curious, is this bill only for nonprofits that participate in any or receive any funding from the state? Do all the nonprofits that take care of our IDD residents, do they all receive funding from the state?
This bill speaks to the nonprofit employees who provide services to people with IDD who are authorized by DSS and DDS to receive services.
Okay, so they may be authorized by DSS, but they don't necessarily receive funding from the state. Is that correct?
No, they would be receiving funding. They'd be receiving Medicaid.
Okay,
Not-
okay.
I just don't take that back, but they'd be receiving funding from the state.
Okay, so if there's a nonprofit out there that's performing the same services that does not receive any funding from the state, they are not included in this, correct?
That is my understanding.
Okay, because I thought the language said all nonprofit employers. And I could be wrong. I'd have to go back and check the language on that. That this really is a labor issue. I'm curious why this bill did not go through the Labor Committee.
Is that a question?
Oh, I'm sorry. Yes, that's a question.
This bill came to us, and so because it addresses providers who fall within DSS, it came from our committee.
Okay, I realize it came to our committee, but this bill really deals with the Labor Committee. And talking about minimum wage, it's talking about healthcare coverage and so forth. And it is my opinion really that this bill really should have at least touched the Labor Committee. Okay, obviously I'm going to be a no on this. I think this is something that we should not be mandating. That you're touching minimum wage now, and it's just, and I think a couple of my colleagues even touched on this. We are opening a door to minimum wage for many other employees around the state. And I think it's very dangerous. And I think businesses and just people in general, these businesses are struggling right now. And I just think I don't want to open the door here to have another minimum wage mandate, whether it's for nonprofits or certainly any other business. And I think this seriously opens the door for that. So I will be opposing this today, but thank you for answering my question.
Thank you, Representative Pizzuto.
Thank you, Madam Chair. Just quickly, I noticed under the public hearing, they had support of AFL-CIO. Would this require union negotiations regardless of profit or nonprofit status?
That is a good question. I don't know, but maybe LCO or do you all?
No, there's no specific provision in this bill requiring unionization.
No, not requiring it, but when you deal with increasing or decreasing benefits, wouldn't that immediately put you at the table with the union negotiators? I can't imagine you could just pass something and without running it by them. Madam Chair. You know,
I don't know.
okay, well, if we can find out, that'd be great. Thank you.
You're welcome. Senator Lesser.
I would just say to the extent that this applies to non-profit providers, certainly wouldn't affect the state employees bargaining contract because this does not apply to state employees. Madam Chair.
Thank you, Senator. We'll stand at ease. Any other questions or comments? All right, seeing none, would the clerk please call the roll?
Item number 4 on the agenda, SB number 1174, an act concerning minimum employee wages, health care coverage, and retirement benefits for nonprofit providers of state administered services for persons with intellectual or developmental disabilities. Motion to JF to approves. Representative Gilchrist.
Yes.
Senator Lesser. Senator Seminara.
Senator Seminara votes no.
Representative Case.
The way it's written, regrettably, no.
Senator Gaston.
yes,
Representative Dathan. Senator Marr. Representative Butler. Representative Cook. Representative Exum.
Representative Exum votes yes.
Representative Fortier.
Representative Fortier votes yes.
Representative Hughes.
Yes.
Representative Johnson. Representative Kit.
Representative Kit votes yes.
Representative Leeper.
Representative Leeper votes yes.
Representative Santiago.
Santiago votes yes.
Representative Buckby.
No.
Representative Ferraro.
No.
Representative Mastro Francesco.
No.
Representative Pizzuto.
No.
Representative Paletta.
no,
Thank you, Madam Chair.
Thank you, Madam Clerk. As was mentioned earlier, we will hold the votes open. Next, we're moving to item 5 on the agenda, Senate Bill 1204, an act concerning the Connecticut Indian Child Welfare Act. This is a JFS to the floor. Do I have a motion?
So moved.
Ooh, a lot of them this time. Moved by Representative Case, seconded by Senator Lesser. This bill codifies the federal Indian Child Welfare Act into state law. The S language that you have before you requires state court to disclose documents to parties in adoptive placement and parental rights termination cases involving Indian children. The terminology was requested by the judicial branch. In addition to codifying the federal law into state law, it has been brought to my attention that it also recognizes Connecticut's tribes that are not recognized in federal law. Any conversation or questions? Seeing none, would the clerk please call the roll?
Item number 5 on the agenda, SB number 1204, an act concerning the Connecticut Indian Child Welfare Act. This is a JFS to the floor, LCO number 6316. Representative Gilchrist.
Yes.
Senator Lesser. Senator Seminara.
Senator Seminara votes yes.
Representative Case.
Yes.
Senator Gaston.
yes,
Representative Dathan. Senator Marr. Representative Butler. Representative Cook. Representative Exum.
Representative Exum votes yes.
Representative Fortier.
Representative Fortier votes yes.
Representative Hughes.
Yes.
Representative Johnson.
Representative Johnson votes yes.
Representative Kit.
Representative Kit votes yes.
Representative Leeper. Representative Santiago.
Santiago votes yes.
Representative Buckby.
Yes.
Representative Ferraro.
Yes.
Representative Mastro Francesco.
Yes.
Representative Pizzuto.
Yes.
Representative Paletta.
Yes.
Thank you, Madam Chair.
Thank you, Madam Clerk. Next, we will move on to item 6 on the agenda, House Bill 6617, an act promoting equity in coverage for fertility healthcare. This is a JF to approach. Do I have a motion?
So moved.
And a second? Moved by Senator Lesser, seconded by Representative Dathan. Any questions or conversation? All right, seeing none, would the clerk please call the roll?
Item number 6 on the agenda, HB number 6617, an act promoting equity in coverage for fertility healthcare. Motion to JF to approach. Representative Gilchrist.
Yes.
Senator Lesser. Senator Seminara.
Senator Seminara votes yes.
Representative Case.
No.
Senator Gaston.
yes,
Representative Dathan.
Yes.
Senator Marr.
Yes.
Representative Butler. Representative Cook. Representative Exum.
Representative Exum votes yes.
Representative Fortier.
Representative Fortier votes yes.
Representative Hughes. Representative Johnson.
Representative Johnson votes yes.
Representative Kit.
Representative Kit votes yes.
Representative Leeper. Representative Santiago.
Santiago votes yes.
Representative Buckby.
Yes.
Representative Ferraro.
Yes.
Representative Mastro Francesco.
Master Francesco votes no.
Representative Pizzuto.
Yes.
Representative Paletta.
Yes.
Thank you, Madam Chair.
Thank you, Madam Clerk. We will hold the votes open. Next, moving on to item 7 on our agenda, House Bill 6665, an act concerning the governor's budget recommendations for health and human services. This is a JFS to approach. Do I have a motion?
So moved.
Is there a second? Moved by Senator Lesser and seconded by Representative Hughes. What you have before you has substitute language. The governor's bill addressed TANF and recommended that there be, if someone rose above the eligibility income limits, they'd be given 6 months before being dropped off to address the cliffs that we have talked about in this building for some time. It also addresses the asset limits. The substitute language builds on the governor's proposal by requiring an automatic additional year on TANF. And so moving us from 20 months to 36 months, and then individuals would be eligible for 2 additional year extensions if they qualified. The S language before you also removes provisions eliminating annual TANF benefit COLA using lapsed funds. It removes provisions freezing rates and prohibiting inflationary increases for residential care homes, intermediate care facilities, community living arrangements, regional education service centers, and nursing homes. And it retains the provisions increasing TANF and SAGA asset limits. It also removes a proposal by the governor's office to have an office to address autism in the Office of Policy and Management, not because we are against that as a need in the state. There are ongoing conversations about what that would look like, where it should sit, and if it should include more than autism, if it should include all of the IDD community. So that is not removed as a policy statement of our not supporting the need to do more for the autism community, just that's an ongoing conversation. Any conversations or questions? Representative Case.
Thank you, Madam Chair. And to your last comments, designated OPM, what does OPM know about or have the ability to know what's going on with autism through you?
I think that's part of the ongoing conversations. It's my understanding that their proposal would hire someone who one would assume would know about autism.
Through you, don't we have an agency, DDS, that might be able to handle, since they do a lot of the work with the autism, and wouldn't they be able to find somebody within their agency to work on the autism level? I'm curious on why moving it to a money policy agency and not to a catchment agency.
And respectfully, that's why we eliminated it, so that these conversations can take place.
I'm trying to see. So that whole section was eliminated out of this? I'm trying to see where it. All right, I'm trying to read through the substitute. I apologize. I did get a lot of substitute language late last night, so. All right, if anybody else has any questions, I'll come back to it.
Representative Dathan.
Thank you so much, Madam Chair, and I appreciate your comments on continuing the dialogue. And the good House Ranking Member and I are working very diligently on 5001, and this is one of the areas that we're talking about. I have been speaking to various members in the community. There is a need for someone to help families navigate what they're entitled to in our government system. And so there is a lot of discussion, where should this sort of person be and what sort of specialties should they have? Right now within DDS, there is an ombudsman that helps people that are serviced by the DDS agency, but that person is not able to appropriately serve the autism community. So what we're trying to do is figure out what we can do cross-agency that can work with Department of Education, Office of Children and Families, and other agencies, also DSS, so that we can ensure that families can navigate and receive the benefits that they're entitled to for their loved one. And I am hoping that the good ranking member will carry on these dialogues with me, and I have a good, strong feeling he will. So I'm definitely, he has a seat, and we both hopefully have seats at the table to carry on this discussion. So we are listening to the community as part of this 5001 effort, and look forward to advancing this to the next stage. Thank you, Madam Chair.
Thank you, Representative. Any further comments or questions? Representative Exum.
Thank you, Madam Chair. And I just wanted to comment on the change in the substitute language as well, which came to my attention and was brought to me really by the Autism Spectrum Disorder Advisory Council. I wanted to let you know that I had every intention of voting for this bill. This is a bill that I support all parts of, and I was really disappointed to see this change that took place. While OPM may not be the area, or it may be, one of the things that they're able to do is look across agencies and look really at the issues that are taking place with the autism community in particular, which we know in the state we have a 2,000 plus waiting list for the autism waiver, which can take 8 years to get these services. And this coordination of effort and putting this emphasis and focus on this community is really important because we do know that students, once they're in school and when the school days are over at the age, say, of 22, there's a big need, an increased need of services and resources that most of the population is unable to utilize. There are not that many that are offered here within the state, which is why the waiver is a resource. But I can tell you that you will be, if you talk to enough people and if you're involved in this council, there's so many people who do not go on the waiting list because of the amount of time that it takes to really utilize and possibly get services. So for me, it is really important that this piece is in. I should also mention I'm a member of the Autism Spectrum Disorder Advisory Council. I'm also a parent, as well as a representative who's serving in that capacity. And for them, this is a priority. They wrote a letter of support for that position at OPM, and they have OPM at the table, and they wish to continue with the structure that had been originally in the original legislation. So for all of these reasons, I'm very sad to say that I will not be supporting this legislation today, and I hope we can continue to work and move forward on this, and that I'll be a part of these conversations. Thank you so much.
Thank you so much, Representative. Any other questions or comments? Representative Pizzuto.
Just quickly, Madam Chair, thank you. When you're on the autism spectrum, what defines, is it Asperger's syndrome, things like that? And I don't want to act like I know it well, but is it anyone on the spectrum qualifies for this? You have to be defined. Sure.
I'm going to refer it over to Representative Dathan.
Thank you very much for your question, Representative. This is part of the 5001 initiative, is looking at, how we define within our state statute who is part of the community that deserves, or not deserves, but is entitled to services. And we are trying to make sure that we can ameliorate the wait list, because currently in our state, we have so many folks who are needing services who are not receiving them. And as part of the greater 5001 initiatives, we are evaluating that. And I'm working on a bipartisan basis with the good ranking member here to make sure that we can ameliorate the wait list. So thank you very much for your question.
Thank you, Representative, for the explanation. Thank you, Madam Chair.
Thank you, Representative. Seeing no further questions and comments, would the clerk, Representative Exum, go right ahead.
I'm sorry, I couldn't get to the button in time. And I want to say I'm completely supportive of the work of 5001. This committee was, the council, I just was curious if anyone, through you, Madam Chair, had spoken to members of the Autism Spectrum Disorder Advisory Council when removing this part of these sections from the bill.
We have not, again, with the thinking being that we will going forward. And certainly to your point and to Representative Dathan, look forward to working with all of you as this continues to move through the process.
And thank you so much. And also, Madam Chair, wasn't this one position that was going to be housed within OPM, not by OPM doing it, but obviously looking for someone who would be an expert for this role? That's the ask for this particular piece as far as appropriations. It was one position. Just want to be sure I was right on that.
Yes, the piece we removed was one additional position in OPM to be focused on this.
Thank you so much, Madam Chair.
All right. Great. Seeing no further questions or comments, would the clerk please call the roll?
Item number 7 on the agenda, HB number 6665, and act concerning the governor's budget recommendations for health and human services, motion to JFS to approves, LCO number 6470. Representative Gilchrist.
Yes.
Senator Lesser.
Yes.
Senator Seminara.
Senator Seminara votes no.
Representative Case.
No.
Senator Gaston.
Yes.
Representative Dathan. Senator Marr. Representative Butler. Representative Cook. Representative Exum.
Representative Exum votes no.
Representative Fortier.
Representative Fortier votes yes.
Representative Hughes. Representative Johnson.
Representative Johnson votes yes.
Representative Kitt.
Representative Kitt votes yes.
Representative Leeper. Representative Santiago.
Santiago votes yes.
Representative Buckby.
Yes.
Representative Ferraro.
No.
Representative Mastro Francesco.
Master Francesco votes no.
Representative Pizzuto.
No.
Representative Paletta.
Yes.
Thank you, Madam Chair.
Thank you, Madam Clerk. As was mentioned earlier, we will continue to hold the votes open. Next, we will move to item 8 on our agenda, House Bill 6857, an act implementing the recommendations of the Food as Medicine Working Group. This is a JFS to approach. Do I have a motion?
So moved.
Moved by Senator Lesser, seconded by Representative Dathan. The bill before you comes out of a working group that was established here at the Connecticut General Assembly that in particular was led by Representative Foster and Representative Dathan. There is S language that removes section 3. So let me get to what the other sections do. So section 1 would have the Department of Social Services apply for a demonstration waiver to be able to cover food as medicine. So this would allow for produce prescriptions for Medicaid enrollees with certain health conditions. Section 2 is having DSS convene a working group to continue discussing recommendations with regards to food as medicine. And the piece that we removed in section 3 would have had Medicaid reimbursement for the services of licensed dietitians. Any questions or comments? I'm going to go to Senator Seminara, followed by Representative Case.
Thank you, Madam Chair. I'm just looking for some clarification on this. So my understanding is a physician would prescribe or give a prescription for food that may help somebody who has some dietary issues or conditions that require dietary constraints. I have some logistical questions so you get a prescription from the doctor, what do? Do you bring that prescription to the grocery store? How does this work?
Sure. So in the bill, it explains that there is a produce prescription. So that's a prescription for fruits and vegetables without added salt, sugar, or fat. That would be given to a Medicaid enrollee with certain health conditions. And then certain health conditions include pre-diabetes, gestational diabetes, type 1 and 2 diabetes, heart disease, hypertension, hypercholesterol. I cannot say this word, dyslipidemia. I don't know if people know that. Congestive heart failure, food allergies, celiac disease, COPD, renal disease, and obesity. And DSS would provide enrollees with vouchers or electronic debit cards that are restricted to purchases of prescribed produce.
Okay, so if they're given a card, the card would just allow them to go to the grocery store and purchase. How do we know that they're purchasing what they're supposed to be purchasing?
So the card would only allow for that. And I do believe this has been done in other states, but that is something that would be looked into by DSS to ensure that we have those parameters in place as this moves forward.
Okay, okay, thank you so much.
Thank you, Representative Case.
Thank you. And moving along on that point, I know the 10 years I've been here, we've talked about these cards. So there's cash on these cards, there's different things on these cards, and we have not really been able to restrict what we can use these cards for. So how are we going to do that now? After the many years I've been here and we haven't been able to do it for other things through you.
It's my understanding that we do, and we have been able to.
So we can limit and people don't have to take cash out through you?
Correct.
So is this card, so these cards are just for people who are enrolled in the state insurance program through you?
This would be for folks who are Medicaid eligible in the state of Connecticut and who then receive a produce prescription.
Okay, so you don't necessarily, so if somebody gets a prescription, they have to go to a DSS office or to a, how do they actually apply for it so they can get the card through you? Is there an income limit? Is there a statute limit? Is there something that limits them, or is we assuming that they already have a card through you?
So the bill before us would have DSS apply for the 1115 demonstration waiver, which would include many of the answers to the questions you just posed. And then this legislative body would see that waiver proposal before it moves forward.
So we're looking for through you, Madam Chair, the 1115 waiver, 3-year pilot program. So I'm just looking for the effective date. This is upon passage. So are we ready with those cards now or for you?
We do have cards through SNAP, which is a different program. But no, the cards wouldn't be ready because we haven't required them to apply for the waiver.
But the language says effective upon passage.
They would be applying for the waiver upon passage, but then they'd have to submit that to CMS before we would be able to get the pilot up and running.
Okay, let anybody else have any questions?
Representative Buckby, followed by Representative Mastro Francesco.
Thank you, Madam Chair. This is newer to me. It's my second term on the committee, so not as many years as a good ranking member. So you get this card and you can go to the grocery store. And does it only allow charges on there that are the produce that was prescribed to them?
Yes,
So nothing else could scan.
correct.
Okay, and this is only for those places who do that. So if it was those of us who come from those other communities where there's a lot of farm stands and a lot of local produce that people, obviously it's healthier for you to eat local and eat local produce. How does that work for a farm stand that does cash?
I think that'd be a very interesting piece to discuss as the waiver is being figured out, because we have in this state allowed for other benefits to be used at our local, farmers markets. And so I think that could be really interesting as the Department of Social Services works out the waiver application.
Okay, thank you for that. I'm just curious why differentiates, this is for certain income levels, I'm assuming too?
This is for those who are eligible for Medicaid.
Okay, so how is that going to differ from the use of food stamps because a doctor prescribed it? That's my concern. Like they could, so you go to the doctor, he says, this is what your produce you should be eating. Why couldn't they use food stamps for that if they're the people, or is this additional funds and on top of food stamps?
If someone is receiving SNAP, this would be in addition to.
So it's additional dollars for that.
Correct.
I'm just concerned as to why it's a prescription. I mean, if people can go buy produce on their own, I'm curious why it's additional in a prescription for that. I guess I'll listen to the rest of the discussion. I can't get my head around how this is gonna logistically work and necessarily why. I like the intent of healthier foods, and I can certainly appreciate that as someone who's been through some of the conditions that were listed with this, and made those healthier choices myself in what foods I'm taking in to help my own health. I'm just concerned as to how it gets put through. And again, I think we're, as I mentioned earlier in this meeting today, I think a lot of times we're putting things through before we have answers for them. If this is effective upon passage, how does that get put into implementation immediately? And I would like to see us have a little more foresight. If this is something that's been through the committee for several years, as we've just heard, I'd like to see some of that be laid out for us so that we could do that before we just jump in the pot here. It looks like again, anything that's going to be going through before appropriations, we should be getting all that work done for them. And I think some of that's still, some of the work is missing on it. So I don't know where I sit right now on the bill itself, but I'm happy to hear more discussion and I appreciate the time. Thank you.
Thank you, Representative Master Francesco, followed by Representative Cook.
Thank you, Madam Chair. I'm curious on, just to follow up from Representative Buckley. I think he asked some of the questions that I wanted answers on. So you talked about SNAP benefits for people that are on Medicaid, and I'm assuming probably a good chunk of people that are on Medicaid, a lot of them probably receive SNAP benefits. And they can certainly go out and buy these healthy products on their own using the SNAP benefits. There's no restrictions on them buying fruits or vegetables or healthy foods using their SNAP benefits. Like I know there's some things that you can't purchase, but when it comes to vegetables and healthy foods, they can certainly use their card for that. Is that correct, Madam Chair?
Yes.
Okay. And do we know, I know this is going to appropriation, so there'll be a Medicaid waiver put in. And should we receive that Medicaid waiver, Medicaid would pay 50% and the state of Connecticut would pay the other 50%. Is that correct?
That is my understanding, but I don't know if there might potentially be more, but I don't know at this point.
Okay, there potentially might be more.
More of a reimbursement.
More of a reimbursement. And I thought I heard you mention that this program is implemented in other states. Is that correct?
Yes.
Do you know, Madam Chair, which states have this implemented?
I don't, but we can get back to you with that information.
Okay. And on lines 37 of the bill, section 2, it talks about a medically tailored meals and putting together meal plans, and it consists of 5 to 21 meals per week. Can you explain to me how that works for you?
So section 2 is regarding the working group that the Commissioner of Social Services would convene. And so when we're talking about medically tailored meals, that's a conversation that would take place within that working group.
So are the medically tailored meals, are they provided to the person who needs them, or is this group just basically putting together a list or a chart of meals? I'm confused on that.
So the working group is charged with studying best practices for integrating medically tailored meals and medically tailored food for Medicaid enrollees with certain health conditions into the state's medical assistance program. And so that definition of medically tailored food is regarding the working group and what they're charged with doing.
Okay, and that work group is in charge with putting together a plan, I understand now, and it's supposed to integrate it into the plan. Is there a deadline that this working group has to report back to the committee? And when will those plans be integrated into the program?
There is a requirement that the working group provide a report with their recommendations not later than January 2024. There is no, that they would report to us, and then that would be up to the legislature to determine if we incorporate their recommendations into future legislation.
Okay, so there's nothing in this bill that has a start date of when that would be implemented. So that's good to hear. I obviously have concerns about this bill. Produce prescriptions. Are there produce prescriptions for people that are not on Medicaid? Do you know of that those are paid for through regular insurance plans, Madam Chair?
That's a great question. I do not know the answer to that.
Okay. And so we don't know if this produce prescription is being used in the state of Connecticut at all, even with a private plan.
Correct.
Okay. Yeah, I have concerns with this. I mean, people that are on SNAP benefits certainly couldn't have advice from their doctors on how to shop healthy. We would hope that they would certainly do that on their own. We don't even know how much of an increase in their SNAP benefits should this pass, we get approval of how much that would be, and how do you determine how much the increase is and how much the prescription is? It's based on somebody's diet, how much they eat. There's a lot of unanswered questions here in this bill. And what I get concerned with, and just in general, I'm just looking at today's agenda, there's so many bills on here that, they're a work in progress. And that is the job of our committee, is to get it done prior to being voted out of committee. The bulk of it, I could see a tweak here and there with a technical revision, but these questions should absolutely be answered. And we are here charged with voting on something that we still have questions on. And I find that very concerning, and it's quite frustrating. And I understand, listen, we have plenty of time. We're in committee for months. We have plenty of time to work these out. I am always an advocate that these things should have the proper language when they are in committee and when they're voted out of committee. And nothing major should absolutely not change when we had to get it to the floor, unless it's just a minor technical revision. So thank you, Madam Chair, for answering my questions. I have nothing else. Thanks.
Thank you, Representative. Representative Cook, followed by Senator Seminara.
Thank you, Madam Chairman. So I wanted to, if okay with you, I wanted to answer a couple of questions that I think might help alleviate some concerns. So we do allow through WIC and other programs the ability to purchase through farmers markets. So you don't have to have dollars. We do have a partnership with that. So that would not be a new program that we would be we wouldn't be inventing. So you can take your WIC checks, if you will, go to your farmers markets. We've partnered with our farmers markets, and they know that it is only allowed to be used for the produce and things through those farmers markets. So I think somebody was asking about using the roadside stands in the farmers markets. And then Representative Buckby, if you're asking me what a WIC check is. Okay. And then there are also penalties already in place or repercussions in place if an establishment allows misuse of a card. And so with the cards now, you are not supposed to be able to buy cigarettes and alcohol. In some cases, you're not supposed to be able to buy soda and a variety of other things. If you go to an establishment and that establishment allows you to swipe your card for the misuse of items, and then we as an establishment get receipts of what's being purchased, there are penalties for that. And that business could also be held accountable, maybe not being reimbursed for that purchase, as well as not being able to be a part of our program moving forward. Some of that also falls on us. I've turned in businesses when I've been behind somebody, and the cashier allowed them to swipe for something, and no longer are they allowed to be a participant in the program. But that's on all of us, I think, right? There's got to be some accountability pieces to that on the businesses, as well as maybe some of us that see things. And the other part of this, I think that's important as well, is being able to write a prescription for food under the Medicaid reimbursement programs would also give us the ability to be reimbursed for those foods, like an insurance claim, which in turn could be money back for us, given the situation as well. So I think that some of the concerns that I heard folks asking might help alleviate. I don't know if it explains all that you're looking for, and I'm not trying to sell this one way or the other. I'm just trying to explain some of the things that we already have in place for a variety of different programs. And I think the important part of like the working group is so some of these things can be flushed out. At the same time, giving the ability to start upon passage is not necessarily the fact that the dollars and cents will be available upon passage, but the working group could start upon passage. So just, I'm hoping that that clarifies some of the concerns and questions. So thank you.
Thank you, Representative Cook. Senator Seminara, followed by Senator Marr.
Thank you again for indulging me, Madam Chair. I just, again, have a question. So if people are able to use either their WIC or their SNAP benefits, is there complaints that there is not enough funds for people in both of those programs, that they can't use that already to purchase these foods?
No, I don't believe that's the intent behind this proposal. There is a move nationally and within CMS to be looking at social determinants of need. And this proposal is looking at the fact that food really should be considered preventative healthcare, right? And a way to treat disease. And so that's why we are seeing this through the lens of Medicaid. And so there would be the produce prescription. And so it is seen as separate from these other programs.
Oh, okay. And then but I'm saying is those other programs don't prevent them from buying fresh produce and healthier foods that would enable them to use food as medicine.
Correct.
Okay. And then the good Representative Cook said that by passage of this, we would get a working group started, but I guess my concern, if we're getting a working group started, we're going to be examining things, yet we're going to be putting things in place as well concurrently.
So there had already been a working group that had been meeting, a food is medicine working group. And so the recommendation with regards to the Medicaid waiver comes out of that working group. And then this proposal is asking for a new working group that would look at additional provisions to address food as medicine.
Okay. All right. Thank you very much.
Senator Marr. Thank you, Senator.
Thank you, Madam Chairman. Just a little point of order regarding SNAP and the use of funds to buy fresh fruits and vegetables. There is not a lot of money on the SNAP benefits for families. And more often than not, the head of households, which more likely are going to be the people who are the ones who are going to be getting these prescriptions rather than children, although they will also probably address children as well. Traditionally, it's the parents who are facing the health issues. When it comes to a parent to go to the store with their SNAP benefits, they are not purchasing fresh fruits and vegetables for the most part because they can't afford it. They need to stretch their dollars. The monies that it costs to buy fresh fruits and vegetables do not allow for that. It is nothing, a mother would want nothing more than to give fruits and vegetables to her children. And should she buy them, most likely she or he will not be eating them. So when it comes to this food as medicine, what's important to note is that this is expanding the ability for people to have fruits and vegetables. I ran a food pantry for 14 years, and it was a self-serve food pantry. And we knew that by putting all the fresh fruits and vegetables up in the front of the food pantry, that would expand people's usage. And literally, despite the weight, which is huge, when you're talking watermelons or, bunches of apples and bananas, whatever, the wait is greater and people were taking buses to get back to their home, but they always took advantage of it. And we went through thousands and thousands of pounds of fresh fruits and vegetables in this food pantry. And one of the reasons we did this is because we knew that people could not access those things for two reasons. One, their SNAP benefits didn't go far enough. And secondly, more often than not, the clients we were serving were in food deserts where those things were not even available. So their food is medicine, and giving people access to more fruits and vegetables, to more healthy food. It's not a choice. They don't do it because they don't like to eat healthy. People don't do it because their money doesn't go far enough. So thank you very much for allowing me to respond.
Thank you, Senator. Representative Case, followed by Representative Dathan.
Thank you. And a few questions, and I think Senator Martin for those comments. Fortunately enough, I know, and Rep Cook being on the board, we do have fresh food and vegetables and trailers that come to the northwest corner, and there's pickups once a month. And there's readily available for anybody who's on state aid to go there and get that food. And that's happening on a monthly basis still going on. So we're offering that food up for people to get there, and the lines are there. And I do know during COVID, there was even a bigger push for those food give outs throughout the area in the north, the farm to table and getting people their vegetables. So when a physician or a doctor goes in and gives a prescription, how long is the prescription good for you?
That would be up to the physician.
So how does the thank you for giving my microphone back. How does the
Madam Chair, don't do that again.
and how does one physician do they ask for the person to be back in a certain amount of time to see how the diet's going, or is this prescription open-ended for that particular individual through you?
So I can only speak to the proposal we have before us, which would establish a 3-year pilot program. So my thinking would be you couldn't do a prescription for longer than that at this point. What is also included in section 1 is a report from DSS annually on the pilot, which would let us know the number of Medicaid enrollees who received produce prescriptions, the data on the effect the produce prescriptions had on their health, the effects of on ranges of food insecurity, and the cost of the state to provide the reimbursement.
So through you, DSS is going to be able to get this information from the physician's office. To the physician's office have to report out to DSS that they're giving these prescriptions through you?
Yes, DSS would know this because these are Medicaid recipients.
Okay. I guess I don't see the tight enough language here to where how long these prescriptions are for. And I do see avenues to where a doctor's office can say, hey, on this day of the month, you have a pickup of free fruits and vegetables at this location. Fortunately enough, I mean, we have, I know of 3 locations just in the northwest corner where there are food deserts. But the lines are extraordinarily long, and those people can get fresh food and can get fresh produce. And my other concern that we talked about earlier is the farms, and we talked about the card that allows the farms to utilize to purchase those, but is that part of the card going to be part of the prescription, or are we going to be adding to that card in order for them to get more for the prescription through you?
That would be answered through the waiver, but I would anticipate it would be a separate card because it would be their produce prescription card. My hope would be that if the farmers markets already had the ability to take credit cards and these types of cards through other programs in the state, that we would easily be able to have them accept the produce prescription card.
So I guess that brings me another question. So, I mean, we've been working on this for years and we've been told that we have one card. The federal dollars and the state dollars go on one card. Now we're going to be producing finally a loan card just for prescription produce. In the past, we've been told we can't do that because it's too costly to put a separate card for separate things. And our cards that we have out there now with TANF dollars, it has all sorts of dollars on it. Are we actually going to produce another card, and have we looked to DSS to see if that's even possible? Because in the past, it hasn't been possible.
I think we are confusing two different things that have been worked on over the years. What has been worked on over the years, but I was not here, was the conversation about putting these things on multiple things or having multiple things on the same card. I believe because those programs are connected to the federal funding, that might be a barrier. This is separate in that this is a waiver to Medicaid. And so as DSS is applying for this waiver, they would determine if it's a separate card.
But I agree, and the federal dollars are on one card, but the state dollars are also on that card. And we were told we couldn't facilitate a separate card because of the costs to put state dollars on one card and federal dollars on another, because on that state card can also go other things. I believe child support and other things can be downloaded onto that card. So are we able to produce another card? Do we know that through you?
I don't know that at this point. That would be answered in the application as DSS applies for the waiver.
Okay, as Member Master Francesco did say, I mean, there's a lot of open questions here and a lot of things that we need to look at. I don't know if we're there yet with this. I get it. I think that we can use the TANF dollars that people have and go to the store and get the foods that they need. If the physician or the doctor says, this is what you should be eating, there's a food pickup at here every Wednesday from 12 to 6, stop by, get your fresh food. But in order for us to do this, I think we need to see where the doctors are, where DSS is. I just don't know how long we leave. We have 30-day prescriptions. We have 90-day prescriptions. Right now, we're cut off for medication for a 90-day prescription. Through you, would this cut off at a 90-day prescription and the person have to go back to the physician?
As I mentioned earlier, that would be discussed as DSS is writing and applying for the waiver, and then we as a legislative body would review that waiver application.
Do we have any idea of how many people possibly we have eligible for this waiver?
I do not, but as I mentioned earlier, DSS is required in this bill you have before you to report to us annually on the number of Medicaid enrollees who receive the produce prescriptions.
All right, I'll leave it at that. Thank you, Madam Chair.
Thank you. Representative Dathan, followed by Senator Seminara.
Thank you very much, Madam Chair. Just wanted to remind the committee what we're talking about. We're talking about food as medicine, which is the spectrum of services, programs, or interventions that address the link between insecurity, nutritional status, and chronic diseases. These program policies and interventions help tailor food and services to promote nutritional related health. So these fruit and vegetable prescriptions are tailored towards the individual. A lot of our food pantries that do amazing work in our state that provide food to people who do have food insecurity may not always have the most medically tailored food to individuals. So for the example of someone who suffered from chronic diabetes, if all is available through the food pantry is grapes and bananas, they are not going to be appropriate for someone who has diabetes, where someone who has diabetes might thrive a little bit better on sort of strawberries, if you will, or other sort of non-starchy vegetables and green vegetables. So this part of this whole exercise is looking at all of that. There is loads of peer review data on this, and I understand that the White House and the Biden administration is very hoping that this moves forward and providing states the ability to do that. Someone did ask earlier about the states that do have this, and I just wanted to highlight there are several states that have programs within their agencies, and that includes Maine, Michigan, Iowa, California, New Mexico, Oklahoma, Mississippi, Louisiana, Virginia, Maryland. And there are several other states within their health or social services, which would include DSS and other sort of Medicaid services, which is Massachusetts, Rhode Island, New York, Pennsylvania, Ohio, North Carolina, South Carolina, Illinois, Minnesota, Colorado, Utah, Arizona, Oregon, and Washington. And Wisconsin has actually passed legislation, but they are still in the process of implementing this. Again, you know, these are the White House is really focused on not just addressing the hunger issue, but also improving the nutrition and reducing the number of diet-related diseases and disparities that so many people that are part of food deserts face. So I hope that answers some of the questions. Thank you, Madam Chair.
Thank you, Representative. Senator Seminara, followed by Representative Pizzuto.
Thank you again, Madam Chair. A question in my mind was raised when we were talking about the follow-up with the physician. So a physician is going to write a prescription. We don't know for how long. The max would be 3 years, given the bill's current language. But we don't write medical prescriptions for more than 90 days at this point. So I don't know if it's 3 years or 90 days that we're writing the prescription. But I guess my question to you is, if let's assume they're writing the prescription for 90 days. Is a person required to come back into the office to verify whether the 90 days of being on fresh fruits and vegetables have improved them, and how would that be verified that, you know, eating this healthy diet? I know that eating a healthy diet is going to improve someone's health, but if we're going to be prescribing this, you don't continue prescribing things unless you see a benefit, and making sure that there is a benefit, and there should be a actual data that shows that there is a benefit. And I'm just wondering, has that been tightened up in this bill?
So just to clarify, the 3-year was with regards to the pilot program. So having watched the Department of Social Services and engaged in their waiver application process, many of the questions that you're raising and others are raising about the logistics of this program are what they will be discussing in their application process. And so, no, we do not have before us answers to the questions you're posing, because that will be worked out as DSS, as we charge them with applying for an 1115 demonstration waiver.
Okay, are we going to roll out this benefit? Are we going to roll out this benefit without, I guess my question is, I'm not feeling confident that everything has been worked out in this bill in order to roll it out. Are we ready to roll it out?
They will work through the application process, and then they would submit their waiver application process to us. And so we would review that before it goes to CMS. Senator, do you have?
No, I don't have any other questions. Thank you.
Thank you. Representative Pizzuto.
Thank you, Madam Chairman. I'm not sure if you know the answer to this or not. It's a question as much as a comment, but in the substitute language, we took out the section adding medical nutrition therapy. My question, or the comment actually, is possibly when the working group convenes, can a certified dietitian be the actual prescriber versus a physician who may know your one's complete medical history? Because in there, that language is in there or was in there, and I'm sure it'll come again. And I don't know if you know that, were they able to prescribe?
I do not know that, and that would be great if the working group can look at that piece.
Okay, thank you, Madam Chairman.
Thank you. Representative Buckby.
Thank you, Madam Chair, for the second time. I appreciate all the clarity people are trying to bring up to my concerns and definitely solid points. And I think part of the concern I have is one, the smaller farms, which is what we have a lot. I'll even mention the Northwest Corner to make a ranking member, as we're the lower part of the Northwest Corner. There's a lot of small stands that just are cash operated. And again, your local farms are going to be your best bet for anyone to buy local produce. I pushed for years that we should have more of that in the schools. Schools should have local produce. There should be motivation for that. I guess my concern is if we don't have the tracking done, even though the good representative mentioned so many different states are offering a similar program. Let's say as a diabetic, I went into the store, I can still buy the bananas and the grapes and do the whole thing, all the stuff that's not good for me to load up and bring home. There's no check and balance to that because it's going to say produce on the form. It's again, a lot of money being put into this for something that doesn't have necessarily checks and balances for it, for us to look at. When you look at, hot dogs would fall into that. But again, I'm sure, as the good representative from Torrington area mentioned, the concern's going to be, to me, in what people are purchasing and what they have the ability to buy. The comment made about watching someone else in the store, great that you spotted it. How many of us have ever had, honestly, in the last, let's say 5 years, how many times has a cashier asked you to see your ID to match your credit card? They don't even look at that. They don't know what you're using to pay for it. So the training is going to be a further process too, with the farmers markets, with everybody across the board. And let's be honest, they're all hurting for money now. A lot of them are going to be happy to sell you what they have, the product they have in these smaller stores as well. So yes, we can say there's penalties. Yes, we can say this, but I think it's a recipe for fraud on so many pieces of this that make me concerned. I also feel, and this may not be the right committee to bring it up, but I think the prices we've driven out of control. The highway use tax is a great example of things that are driving the cost of food and produce up in this state. This is a ramification of what we've done in this building in driving up some of the taxation that we have on some of this. So I think we're looking at this kind of backwards. I think that's why there's such a huge cost on some of these things. And I'm sure this is going to pass through. And I know the intent is wonderful and want people to be healthier and happier. I just see it as a recipe for fraud and concern with it. I will be more than happy to see what gets changed before it hits the House floor. But I think at this point, it's not something I can still support. But I definitely want to thank everyone for their input on this as well. Thank you, Madam Chair.
Thank you, Representative. I don't see any additional comments or questions. Would the clerk please call the roll?
Item number 8 on the agenda, HB 6857, an act implementing the recommendations of the Food as Medicine Working Group, motion to JFS to approbes, LCO number 6250. Representative Gilchrist.
Yes.
Senator Lesser. Senator Seminara.
Senator Seminara votes no.
Representative Case.
No.
Senator Gaston.
Yes.
Representative Dathan. Senator Marr.
Senator Marr votes yes.
Representative Butler.
Representative Butler votes yes.
Representative Cook.
Yes.
Representative Exum. Representative Fortier.
Representative Fortier votes yes.
Representative Hughes. Representative Johnson.
Representative Johnson votes yes.
Representative Kitt.
Representative Kitt votes yes.
Representative Leeper. Representative Santiago.
Santiago votes yes.
Representative Buckby.
No.
Representative Ferraro.
No.
Representative Mastro Francesco.
Master Francesco votes no.
Representative Pizzuto.
No.
Representative Paletta.
No.
Senator Lesser.
Yes.
Representative Exum. Representative Leeper. Thank you, Madam Chair.
Thank you, Madam Clerk. All right, that brings us to number 9 on our agenda, Senate Bill 1053, an act establishing a task force to study and make recommendations concerning the elderly nutrition program.
So
This is a
moved.
JFS to approve, so moved by Representative Cook, seconded by Representative Case. Everyone's very excited. This bill was on our agenda last week, and I want to thank Representative Cook and Representative Case for working in the interim to update the task force language. What you have before you adds the human services chairs and rankings or designees to an elderly nutrition task force, along with elderly nutrition providers representing community action networks and state associations of nutrition and aging service providers, and requires the human services chairs to chair the task force and convene by August 1st and report out by next January. Additionally, Section 2 appropriates an additional $2 million each year for the elderly nutrition program. As was just discussed in our prior conversation, there are increased costs for food in the state, and so we are increasing that funding. Any comments or questions? Representative Cook.
Thank you, Madam Chairman. Our chairwoman, I'm sorry. The comment about the dollars and cents, I just want to make it clear that it's not necessarily spelled out in this piece of legislation, but that is in another piece of legislation. Could you clarify? Senator.
Madam Chair, I want to apologize for distracting you during Representative Cook's questioning.
Could the good representative please repeat her question?
Madam Chairwoman, you had just addressed the 2 million in, could you please clarify where that language is? As I know that this is literally about the working group and what we need to do. And we had heard from our providers that this is so vitally important. I would just like to know where we could find the dollar that you had just referred to.
That piece is in the new Section 2 in the S language of this bill, and would still have to go through the Appropriations Committee process.
Perfect. Thank you. I want to thank everyone for working on this and for the bipartisan amendment that we had put on the table to ensure that the appointments were leveled out. So thank you.
Thank you for that work. Representative Buckby.
Thank you, Madam Chair. First off, I'd like to say how incredible it is to see the good bipartisan work of the Torrington contingency working together. I mean, that alone is heartfelt. That's so great to see these two individuals, especially working so closely. And second of all, I want to commend the committee with this bill that where it's similar to our last bill, but we're putting the working group out. We're getting the work done. We're getting all the things laid out so that we can move forward, not trying to put too much into one bill. I think this is a smart way to approach it. This to me is good legislation on what we're trying to do, and certainly a bill I'll support, even though it comes from Torrington in so many ways. Thank you, Madam Chair.
Representative Case.
You just beat me to it. And to Rick Buckby's point, this is something that we are working on ahead of schedule, and we're working to make sure that we get this done. I want to thank the chair for allowing us to put this on hold last time so that we can get the people that are sitting here at the table so that we can draw this up and make sure that we're doing the right thing. And once again, coming out of the best city in the northwest corner or the state, I'm sorry we didn't have New Milford involved, but we're town.
Senator Lesser.
Yes, thank you, Madam Chair. And I just want to thank all of the stakeholders, the area agencies on aging, the Connecticut Association for Community Action, the Connecticut Association of Nutrition and Aging Service Providers for giving us additional information about the current needs that are out there and how we can best address the pending shortfall due to the expiration of federal ARPA funding. And this was an issue that we've been working with them on, and the additional information that they've been able to bring to this committee since the last meeting has been super helpful. So thank you.
Thank you, Senator. Seeing no further questions or comments, would the clerk please call the roll?
Item number 9 on the agenda, SB 1053, an act establishing a task force to study and make recommendations concerning the elderly nutrition program. The motion is a JFS to approach LCO number 6467. Representative Gilchrist.
Yes.
Senator Lesser.
Yes.
Senator Seminara.
Senator Seminara votes yes.
Representative Case,
Yes.
Senator Gaston,
Yes.
Representative Dathan, Senator Mar, Representative Butler,
Representative Butler votes yes.
Representative Cook, Representative Exum, Representative Fortier,
Representative Fortier votes yes.
Representative Hughes,
Representative Hughes votes yes.
Representative Johnson,
Representative Johnson votes yes.
Representative Kit,
Representative Kit votes yes.
Representative Leeper, Representative Santiago,
Santiago votes yes.
Representative Buckby,
Yes.
Representative Ferraro,
Yes.
Representative Mastro Francesco,
Master Francesco votes yes.
Representative Pizzuto,
Yes.
Representative Paletta.
Yes.
Thank you, Madam Chair.
Thank you, Madam Clerk. We will hold the votes open until 1 p.m. That concludes our business. However, as was mentioned at the beginning of the meeting, this is our final meeting of the Human Services Committee for this session. And I want to thank everyone at the table, my good rankings, my co-chair, and all the members for just fantastic work throughout our process. I also want to thank our clerk, who is new to the Connecticut General Assembly, but you wouldn't know it, Chandra Perswad, who has just done a tremendous job this session. Thank you. And our assistant clerks, Isaac and Kelly, thank you so much. Want to thank our LCO, Marie Grady, for your tremendous work. And our team from OLR, Jennifer Proto and Mary Fitzpatrick. Thank you. And then our team from OFA, Emily Shepard, Christina Gelman, Lindsay Donson, and Rachel Della Pietra. Thank you so much. And finally, our policy staff. There's a lot that goes on behind the scenes, a lot in our bill screening process. And so couldn't have done it without Brittany Kane, Adam Johnson, Christopher Adams, Sean Cleary, and Julia Anderson. Thank you all. All right, now on to the next phase. Thank you, everyone. Have a great day.
Madam Clerk, Rep. Butler, ready to vote?
And also, Madam Clerk, Rep. Johnson, ready to vote as well. So thank you, Chandra.
Hi, I'm here. Sorry about that.
No worries, we're here.
All right, I will do Representative Butler first, and then I'll do see what let's see what votes we have. So for Representative Butler and Representative Johnson, we have SB 989. It's a JFS to the floor, LCO number 6866468. Representative Butler, how do you vote?
Representative Butler votes yes.
Thank you. Representative Johnson?
Yes.
Thank you. Next is SB 1109. This is the JFS to approach, LCO number 6469. Representative Butler, how do you vote?
Representative Butler votes yes.
Thank you. Representative Johnson?
And Representative Johnson votes yes.
Thank you. Next is SB 1111. This is the JFS to the floor, LCO number 6356. Representative Butler, how do you vote?
Representative Butler votes yes.
Representative Johnson?
And Representative Johnson votes yes.
Thank you. Then we have SB 1174. This is a JF2 approach. Representative Butler, how do you vote?
Representative Butler votes yes.
Thank you. And Representative Johnson?
And Representative Johnson votes yes.
Thank you. And then I think that's all for you, Representative Johnson. Representative Butler, I have one more. It's SB 1204, an act concerning the Connecticut Indian Child Welfare Act. How do you vote?
Representative Butler votes yes.
Thank you very much. I think we are all set with, oh, actually, sorry, Representative Butler, I have one more for you. I have HB 6617, an act promoting equity and coverage for fertility healthcare. This is a JF2 approach.
Representative Butler votes yes.
Thank you. Are you, oh, I
We
lied.
have
There's
one
one
more,
more.
don't
There's
we?
one more. HB 665. This is the JFS to approach LCO number 6470. How do you vote?
Representative Butler votes yes.
Thank you. And I think we're
And
all.
I believe that's it. And thank you for all your good work during the whole session. Appreciate
Thank
it.
you. Appreciate it.
Yes,
Thank you.
Chandra, thank you very much. Appreciate all your help and work
Thank
through the
you.
session. Thank you.
Thanks, Rep. Johnson. Appreciate it.
Yeah.
Representative Johnson.
Hi.
Hi, I think we're missing 2 votes from you. It's HB 6857. It's a JFS to approach LCO number 6250. How do you vote?
I vote yes.
Thank you. And then SB 1053, enact and establish a task force to study and make recommendations concerning the elderly nutrition program. This is the JFS to approach LCO number 6467.
Yes.
Thank you so much.
And I want to thank you as well. You've been fantastic. Thank you so
Thank
much.
you.
And I would have done it without you.
I know. Have a good one.
You too. Thank you.
Thanks. Hi, Rep. Weaver. I think I'm missing 2 votes from you. So it is, actually, I'm sorry, it's 3 votes. I lied, it's 4 votes. Sorry, 4 votes. So we have SB 1204, and not concerning the Connecticut Indian Child Welfare Act. This is JFS to the floor, LCO 6316. How do you vote?
Representative Leeper votes yes.
Thank you. Next, we have HB 6617, and act promoting equity in coverage for fertility healthcare, JF to approach. How do you vote?
Yes.
Thank you. Next, we have HB 6665. This is the governor's budget recommendations for health and human services, JFS to approach, LCO number 6470. How do you vote?
Yes.
Thank you. Next, we have HB 6857, and act implementing the recommendations of Food as Medicine Working Group. This is a JFS to approach, LCO 6250. How do you vote?
Yes.
Thank you. And last but not least, we have SB 1053, an act establishing a task force to study and make recommendations concerning the elderly nutrition program, JFS to approach, LCO number 6467. How do you vote?
Yes.
Thank you. Let me just make sure. I'm pretty sure you're not open, but I want to make sure for you. Leave and you are good. Yep, you're all set.
Awesome. Thanks, Chandra.
Thank
Have a
you.
good one.
Bye.
Bye.